Good morning, good afternoon, everyone. So this is the USMLE Sarthi team, and we are back with our webinar to help you with your interview preparation. So today we have a great panel. We have Dr. Sukrut Pagat, who is USMLE Sarthi team. One sec. So we have Dr. Sukrut Pagat, who is a PGY1 resident in Ohio. So University Hospitals of uh, St. John's Medical Center. And then we have Dr. Kimberly Cousins, who's a fellow at Mount Sinai Icahn School in allergy immunology. So before we start, let me just open it up for introductions. So Sukrut, if you want to go first.
Thank you, Pavan. So my name is Sukrit Pagad. I am a PGY1 in internal medicine, and I'm currently doing my residency at University Hospital St. John's Medical Center in Ohio.
Thank you, Sukrit. Kimberly?
Hi, I'm Kim Cousins. I am actually a second year fellow at Mount Sinai Hospital. I'm adult trained in internal medicine. I did my internal medicine training at Howard University Hospital and originally did my medical school at the University of the West Indies. It's nice to be here. Thank you for having me.
Thank you. Thank you. So, let's just dive right in because applications are in now and students have started preparing for their interviews, and our own students, of course, at USMLE Sarthi have already had some classes and have started preparing. So let me first open up with some questions. What are some of the must prepare questions that the students have to do as they prepare for the interview? So Sukrut, let me go to you. What would be the top questions you will recommend that students prepare for?
So the top questions that I would recommend students preparing for, and these are the questions that I kept getting asked were, tell me about yourself, your strength, your weakness. Why did you choose a specialty? So in my case, why internal medicine? And then why did you apply to our program? And a behavioral question that I kept getting asked was, tell me about a time that you worked effectively under pressure.
Okay. So Kimberly, what are some of the questions that you would recommend? And then we go into, how to tackle these questions.
So Super made a really good point. One of the biggest things I like to say is to prepare a narrative for those baseline questions. You're not going to get away from answering the very basic, tell me about yourself, as well as behavioral questions. It's actually something I've been noticing recently along the fellowship trail too. And that's for the future to note. One of the few things on top, or a few of extra stuff on top of the very baseline questions that you will be getting is things about yourself in terms of your hobbies. They will ask you about that. So whatever you list as your hobbies, be prepared to talk about that. Be prepared to talk about your research activities, be prepared to talk about things that you put on your resume or on the ERS CV. And then also just kind of know that there will be questions that you may not prepare for. And I think one or two of them I actually got along the trails. For example, tell me a book that you're reading right now, and specifically a non-medical book. So they want to know not just your medical career, but who are you outside of that career? And that's going to be something that you have to prepare for, right? Okay, I think that's the kind of like the first version. And so to add to the baseline questions.
Okay, so what you're saying is baseline questions plus be very, very clear on your hobbies or the non-medical side of the personality that they could obviously ask you. And again, be prepared for the unexpected questions. Okay. Now let's, we have some good structure in terms of the type of questions that both of you have told us. Now let's talk about the strategy to answer these questions. So Sukrut, maybe we'll start with you again. And how would you recommend students prepare? What should they be doing as they are preparing to answer these questions?
So the way I prepared for the interview questions was, I sat down and I made a list of all the possible questions that I could get asked. So I had my standard questions, behavioral questions, and questions like I studied my CV from top to bottom. So I came up with questions that the interviewer could ask. Then I would come up with answers. I would have 3 to 4 bullet points I would talk about my strengths and how we would tie to the specialty and how it brought value to the program. Then I wrote them down and then I kept rehearsing those responses. It's not a one-time thing, two-time thing, or a day or two before you have your interview. We need to consistently sit down and prepare for these answers over and over again in front of the mirror and rehearse them. And an essential part of my preparation process was that I participated in mock interviews. I had friends, and I also had, I was very blessed to have USMLE Sarthi to help me guide through the entire process. And that's something that we, USMLE Sarthi also provide services as well. We also have classes where we teach students on how to come up with answers for all possible scenarios and questions and how to prepare and how to provide a responsible answer. Always have that appropriate speech volume and tone and make consistent eye contact and, always display appropriate emotions and facial expressions. Now, these are some of the key points that you need to keep in mind when you answer any interview questions.
Okay, so let me rephrase to make sure I understood. What you're saying is obviously practice, write down your responses, align it to the specialty, align it to the program, which could change, of course, and then just practice, and whether it's in front of the mirror or with the friends, or of course, as part of our classes. Kimberly, what is your suggestion in terms of structuring these responses? How should students prepare for these questions?
So Sukur also brought up a really good point. Creating what I like to say is always create your narrative. You have these very specific questions that you need to know how to answer. And I find that in medicine, it's so difficult on a day-to-day basis where we're not taught to answer things like, tell me about yourself, or, we're taught about how to diagnose, how to treat, but not necessarily to sell yourself. And so that's what I really loved about what the structure of the USMLE Sarthi has. For me, I was a little bit lucky. I like to tell my story because my best friend is a journalist and my other best friend she's essentially like the CEO of a major company. And so I was lucky to kind of have the guidance to sit there with these questions, and they would structure answers with me and work with me. And so to bring it back to what Sukur says, you need to be practicing this 24/7, whether it's in the shower or it's like you're walking on a date, rehearsing the answers in your head, and they should be true to who you are. I think that's really important. That's why I always say, look inside and create that narrative, because when it's very true to who you are, it will come out naturally in the interview. So another strategy I really like to touch on is knowing about keywords to use.
Okay.
And to have very specific words that you want to throw in the conversation that are going to fill the gaps. And these are words, for example, empathy, communication, teamwork, right? When you start to practice saying these words, they will come out in the conversation very naturally, especially in the behavioral type questions, which sometimes you're not ready for. And then thirdly, you want to kind of take out some extra filler words that don't belong there. You want to practice not saying, or, those are the type of filler words you kind of want to stay away from. So those are 3 very effective strategies that I love to use, in addition to what Sukur had said.
So let me just expand on this a bit and maybe pick your brain. So one of the interesting things you mentioned is keep practicing with these keywords, whether it's empathy, leadership, teamwork, giving back to community. The second, of course, is take out the filler words, and that obviously comes with practice. I want to dig a bit deeper into framing your own narrative. How should students build their stories? What are the type of experiences, or how much back in the history they should go? What things they should pick to create this narrative about themselves?
I could go first if you'd like.
Yeah, please.
So when I was first interviewing for residency and then also interviewing for fellowship, one of the things that I found as my narrative that was very unique to me, and this is what I want everyone to take away from this: your story is going to be your story, and who you are will come out in the interview, but you want to be pragmatic and you want to make a mark, right? Everybody who's going to come in there is going to say, hi, my name is this. I trained here and here, and this is what I'm doing now. That's not going to let you stand up for the crowd. And so one of my biggest narratives is I would always walk in and say, hi, I'm Kim Cousins. And then they will say, tell me about yourself. And I'll smile and I'll say, I find that's always such a difficult question to answer, because who are we really? So what I like to start with is a little bit about my background. Since I'm technically very racial ambiguous to most people in America. I was born in Toronto, Canada. I grew up in Jamaica. In terms of my race, I'm white, Black, and Asian, like a panda. And so I make a small joke to open up the conversation. And when they smile, that's when you've caught somebody's attention. And you want to start with a sentence that's going to be smart, catchy, cheeky, something that's very unique to you, that's going to bring attention to you. So that's what I mean by a narrative.
So that's very interesting. How can one or a couple of sentences capture the essence of who you are and that they remember? So the way you explained it obviously makes it very, very clear. Okay, that's so 3 things to focus on: your narrative, take out the filler words, and keep practicing with the keywords. So good strategy. Sukrut, let me go to you and talk a bit more about behavioral interviews. So tell us more about these behavioral interviews and how students can prepare for these.
So there are a bunch of behavioral questions that are on the web that you can find. It was initially developed for businesses, but now it's been used with increasing frequency. I mean, like Kimberly said, it's been used in fellowship interviews as well. It takes a core list of competencies that are required to be a good resident physician, then develops a series of questions that will allow the interviewer to explore your past performances in this area. So that's when they ask you, tell me a situation where you excelled in a difficult scenario, or how you dealt with a difficult patient. They don't really want that. They want to see how you handle this situation and what traits that you implemented or experiences that you have. And it's a way for them to understand, to get a better idea of who you are and what you bring as a resident. And I think behavioral questions have a lot of value in residency, in interviews, especially because this is a short period of time where if you ask your standard questions, you don't really get to know the applicant. So that's where the role of a behavioral interview comes in. And the way I framed it, and it's a popular way of formatting a behavioral interview, is a situation, task, action, or result. And what I mean by the situation is you describe the situation in detail. What happened? You paint a picture. So this is a 50-year-old female with a past medical history of XYZ who was admitted for this and this and this. And this is what I was called in for. And then what action did you take? How did you, so if this is a difficult patient, how did you communicate with this patient? How were you able to convince them to be compliant with the medications? And then the result is, what was the result? Did the patient listen to you? If not, what extra step did you take for the patient to listen to you? And that's how I prepared for behavioral type questions.
Okay, thank you. So Kimberly, before we move on to the other topic, did you have any other tips on behavioral interviews, specifically behavioral questions?
So before we do move to the behavioral questions, I do want to bring something to attention that Sukrut actually shows right now live as we're going. That's going to be really important in the interview, his hand actions. And when he's speaking, his hands interpret his enthusiasm for what he does. And that's also a really important point that you want to take away from that. You know, I think on Zoom it might be a little bit tougher, but in the previous times, this is exactly what interviews will come back to be in person. And that's exactly, they're watching your body language, and that's really important. In terms of behavioral questions, some of the things that I use to structure is not just answering exactly how Sukru answered, which you must hit those key points, but also adding a personal flair to it. And so when I was interviewing, for example, during fellowship or during residency, and it was a behavioral type question, I would explain to them my own personal experience, which is, you know, tell me about a difficult time with a patient. And I would add a section where it says, well, you know, my training is very unique, where I worked with an LGBTQ clinic as primary care, especially in a predominantly African American community. And I feel that this specific community is hurt. And so I had to learn to adapt to that situation and to learn to change my form of communication to strengthen that bond between patient and physician. And so that's where I want you guys to kind of see that it's no longer just patient came in, they're febrile, septic, this and that. They want to see who you are in a point of contact with the patient, and how are you going to create teamwork between you and your patient to create a better outcome. And these are some of the keywords they like to hear. Better outcomes, decrease in mortality, having data to back some of the things that you're doing. And you want to definitely take away these words from that. So that's the only addition I would add to behavioral questions, to add that personal experience in addition to primary management, and to make it something that will leave a mark.
Okay. And before I move on, I do want to get back to something you had mentioned, which is, you know, there will be times that students will be stumped. They will get an unexpected question. How do you get out of it? How do you get out of if you don't know the answer or it's unexpected? Any tips?
Yeah, so I think I'll answer first. So I think one of the big things that I like to do is practice fillers that have purpose, right? So you don't want to sit there and say, so when I'm stumped, I make a slight joke and I'll say, wow, Dr. X, you hit me with a hard one there. Let me ponder on that for a second, you know, and then I'll smile and then I'll make a joke, right? And then hopefully within that 30-second loop, the answer will come. So you want to practice to find fillers that will lighten the situation, that you will find that answer going forward, and try not to stress out. Like these interviews are not meant for you to like walk away in a complete panic attack. They're meant to have a casual conversation so they can find out who you are. And that's why you should practice with your friends, set appointments to talk to mock interviewers, because, you know, if it's something that I've seen so far, it's always best to have somebody come back and say, this is how you could have structured it differently. Because sometimes in our mind, we might think that we're doing the best work possible. But if somebody is looking down globally, then it's always good to get that feedback, you know?
Yep. Sukrut, any other tips on how to get out of tough questions or something you may not know the answer to?
Just to reiterate what Kimberly said, if you do not know the answer, you don't have to come up with an answer. Take your time. They understand that you're in a difficult situation. They don't want to put you in a difficult situation. They've been in your shoes. So all you have to do is just, like she said, you know, just take your time. Say, you know what, I'm going to take a few seconds to think about this answer. And it's fine. It's fine to pause and think, because it shows that you're not impulsive, that your decisions are made in a thoughtful manner. So once you do that, even if you can't come up with an answer, just be honest about it and practice. If you practice, I don't think there will be a situation where you will always have an answer to any difficult question.
Okay. All right. Before we move on to the next section, I do want to remind our viewers and audience that our interview prep has started, mock interviews, classes, and everything. So if you're interested, I have the link in the chat, and you can take a look and we go from there. Now, moving on to the next section, we spoke about what the students should prepare for and how. Now let's talk about what the programs are actually looking for when you are interviewing, and of course, virtually this season. So Kimberly, back to you. What do you think? What are the top things a program director or others in the committee are looking for as they are interacting with you on the interview day?
That's a really good question, Pawan. By the way, that's also a filler that I use when I don't have the answer immediately. Practice that one. um, so I think a lot of what program directors are looking for, and this is beyond just the CV, they're looking to see how you're going to work alongside other people, because the medical profession can be a very stressful one. And if you're not able to work harmoniously with a team, they don't want you, because you could be the brightest person on the planet. If you cannot work with a team, you cannot structure yourself in multidisciplinary teams to create a better outcome for the patient. And so they're looking for that. They're looking to see, do you express empathy, right? Do you communicate very well? And that's going to be a really major component of the interview. They're watching to see your level of communication skills, because if you cannot communicate in this interview, how can you go out into real world and into the practice and communicate as well to the patient? And so these are key things that they're looking for during that time. And they're, you never want to show them red flags. You want to show them that you're a team player. You're very successful, you're very confident, and you will add value to their team. So those are the main things that they're looking for thus far, beyond, of course, doing very well in exams. I don't need to reiterate that point. Like we're all in medicine here. We know the basics.
Okay, Sukrut, anything that Kimberly missed in terms of what programs are looking for?
So just to summarize, I couldn't have said it better than how she framed it. So the first thing is, communication skills, especially in internal medicine. It is paramount for a resident to have good communication skills with the patient, because only if you have good if you can communicate well from them, you can gather the necessary history from them. The second thing is to be a good team player. In a hospital setting, there's multiple specialties. There's different specialties that are involved in the care of a patient. So you need to be able to interact and work as a team player. Third thing is, what else can I think of? Third is how you be a team player. Already talked about good communication skills. I think that those are some important things that I can add right now. I can't think of anything else.
Okay.
I would just also like to say that Sukrut's body language is fantastic. So he's adding that as well. They're looking for that. Please.
Okay, so body language, obviously, even in virtual setting, is important. And to our audience, you can start putting questions. If you have questions, we'll take them. But that leads us to the next section, which is virtual interviews. Last season was virtual. This will also most likely will be virtual. So what are the things from a virtual interview perspective that, Kimberly, you hit on the body language and all that. What are some of the other things from a virtual interview perspective that students really, really need to nail down? They, whether it's the audio, video, lighting, what things matter in virtual interviews?
So first of all, with whether virtual or not virtual, you need to look professional. You also, for people, and this is something I kind of came across recently, for people who struggle to speak on a virtual platform in full professional clothing, including wearing your tie, you feel choked up, you need to be practicing with your tie if that's the situation. So one, looking professional, having good lighting. You want to make sure that the background is not it's not so dodgy looking background. You definitely want to have something very plain, or just have a virtual background. You want to be looking very clear. Make sure your face is very well put together. They're watching for that, So those are the few things in terms of visual. You want to make sure that when you're speaking extremely clear, and you're also bringing across your message when you're speaking. So that's going to be really important. It's really tough with virtual interviews, I can tell you, because I have, as a fellow, we kind of take parts in the interview process. And if you're not leaving a mark, it is even harder when it's virtual, because you're not seeing the person, you're not making that physical connection, and it makes it really hard to remember. So you have to bring to the game something that is going to make you memorable. And that really just comes right back down to the narrative. Make sure your narrative is fun, cheeky, and it's something that's going to leave a mark.
Okay. Sukrit, virtual interviews, you did it last year, and so what was your experience, and what do you recommend to the students?
So Kimberly touched the highlights and the most important things. So I'll just talk about the technical issues. Have a neutral background. So I have my bed in the background, which is fine. Make sure that it is neat and there's nothing distracting in the background. Set up your laptop. Have a good. I have a webcam that's a pretty decent webcam that you can get on Amazon. Have decent lighting. I had 3 different lightings, and the way I structured is 1 on the right, 1 on the left, and there was a shelf higher up which I placed it. So there were 3-point lighting for me. And make sure you have a good mic system, or you can go with the AirPods, so they're fine as well. I think Mac has a pretty decent mic system. And then if you have a chair, don't keep doing this when you're talking. Sit upright. The way I set up my camera system, and people do it differently, is they shoulder a bow and face that they can see. Where I wanted, I wanted some distance between me and the interview where the person could see my hands. So I set up like a table where it felt like it was an interview, where the person was sitting across the table. When I spoke, I use my hands a lot, and that's something that I wanted to highlight specifically. And make sure that you have a stable internet connection. Anything more than 20 megabytes should be fine. That's about it.
Okay, good. Thank you. Now the last kind of segment for today's webinar is things to avoid, absolute no-nos that students should actually be aware of. So part of it, of course, is your professional attire that Kimberly mentioned. Kimberly, what are some of the absolute red flags, things to avoid in the interviews?
First of all, Pawan, there's 1,000,001 red flags that you can avoid. I feel like we can mention 1,000,000 and we will never end this. So I'm just gonna try and kind of touch on a few main ones that come to mind. First of all, very specifically to INGs. I am also an ING, so I know the personal struggle on that pathway matching into the US system. One thing I really feel I wish that somebody had taught me during my residency match was never to highlight weaknesses in our system. We should be proud of our training. It doesn't matter where we train in the world. We are excellent physicians no matter where you come from. And so you should always be proud of that, and don't highlight a lack of resources, because everybody who is from a third world country, we all systemically have one thing in common, and that's that we know a system which lacks resources, and you never want to highlight that. Instead, what you want to do is focus on strengths. And if you are to mention a limitation, there should always be a pivot on a positive. It should be a weakness with a strength of overcoming. So never, ever, ever focus on limitations. When people speak about research, a lot of times some international grads may not have a very strong background in research. And so I find that now, retrospectively looking back, I have a lot of experience in research as I grew in the US system. But one thing I wish I had done differently is not to maybe focus on a weaker background on research, but more so to focus on what I'm interested in looking at, Also, one major thing to really know is about a gap year. And I really want to highlight that. This is very important, because whereas in the US system, what they call a gap year is a time between ending a degree and training. And that's just the way their system is built. It's a bit different from us. You want to find ways of pivoting on what you were doing. And I think there's one thing I had mentioned recently that's super important, that COVID has granted a lot of people a blessing, right? You can now focus on talking about humanitarian work during a gap in training. And so that's a gift to be able to talk about that if you're not doing research or, an extra degree, or if you're just in, if you're specifically just as a medical officer. That is not considered clinical experience in the US, sadly. I don't think it takes away from that experience. I think it's very valuable experience. It's just what the system demands and what the system sees it as. And so you want to kind of shy away from speaking about limitations in research and focusing and pivoting on humanitarian work, right? So you can find strategic ways to make the narrative come into your benefit. And then, of course, you still personally want to continue building. So those are the do's and, the don'ts. Don't lie, but also because if you're backed into a corner to talk about things, you better be able to talk about it because they will pick at it. So you want to put yourself and set yourself up in a strategy where you can speak about something honestly, right? So I think those are my don'ts. I'm pretty sure Sukrit has a million more to add because we can talk about so many.
Yes, Sukrit. So over to you in terms of don'ts for the interview.
So don't be arrogant. Don't be boastful. Always be humble. Don't show emotions. If somebody were to ask, why do you have an attempt on your step one or an attempt on CS? Don't get flustered and be defensive and say, oh no, I have a 250 on my CK. No, that's not what they're looking for. They want to see this attempt. How did you learn from this experience and how did you improve? Then read up on your CV. There should not be anything on your CV that you haven't prepared for. It's unacceptable for you to not know your CV in and out. You've put a research experience and you have absolutely no idea about it, and they asked and you get asked. That's a big no. The third thing is be even if you have an accent. So from an Indian perspective, we have an accent, and sometimes it's very hard for the counterpart to understand. It's fine. Don't be ashamed of it, but take your time, just enunciate your words and be concise and be confident about who you are, what you bring to the table. And what Kimberly said, even though you're from IMG, you come from a healthcare system where resources are deficient, be proud of it. You've come all this way, and it is not easy. And it's something to be really proud of. And that's some of the red flags I would like to touch upon.
Okay. I did get a question about the duration of virtual interviews. So what is the typical duration? Is it 15 minutes or so? What is the duration of a virtual interview?
So
I actually did one. Oh, sorry.
Sorry, no, go ahead. Sorry, go ahead.
I actually did one on Friday, and this is they range from 20 to 30 minutes. Sometimes you can have panels, right? Every single program is very different. There was one program that interviews went from 8 a.m. to 5 p.m. and it was 13 different interviewers. I've been through interviews where they had panels of 4 people sitting there ready and waiting for questions to ask. It's just going to be program based. On average, you want to prepare to talk to every person between 15 to 20 minutes. And that kind of brings up a really good point. The more you talk, the less time they have to ask questions. So you really want to prepare to answer appropriately and filling in those gaps, because then it takes less time, you have less time for them to ask you the weird and wonderful ones that you were just absolutely not prepared for. So you want to fill that time with meaningful conversation that's going to bring across who you are.
Okay, wow. Good tips. Sukrit, what was your experience in terms of duration of the interviews?
So, like Kimberly said, it varies from programs to program. One program, I had three interviewers, and each I spent about 30 minutes with them. Then there was another instance where 6 to 7 interviewers back to back, and they were about 50 to 20 minutes. It varies. And then you have a group of a panelist, 5 to 6 interviewers who keep asking you questions, and that can be about 30 to 45 minutes. So it varies from program to program. Just be prepared. Say from 8 o'clock in the morning to 5 p.m. you need to have the availability.
Okay.
Well, and prepare to parrot yourself too. Prepare to parrot yourself and say the same thing over and over and over, and find ways to mix it up, right? I would make a joke about that to be like, boy, I feel like a parrot right now. So here we go. You definitely want to not get tired of saying the same thing over and over, because you're going to have to do that throughout the whole day. And also you want to go in and have questions prepared. And if you don't have questions prepared for your interviewer, then you best believe you need to find something to say, because they're going to ask at the end every single time, do you have any questions? So you have to, if you by the end of the day have no more, you want to be prepared to have questions or fillers to say, or compliments to give the interview at that point.
So let's take it up as the last kind of, as we wrap up. Questions for the programs, questions for the interviewers. What type of questions do you recommend, Kimberly?
So first of all, Secret made a really good point earlier. Know your CV inside and out, but also you need to take a look at that interview schedule and know who's interviewing you, and know some of the work that they're doing, and know what their background is, whether it's are they physician scientists, are they clinician educators, are they predominantly research, or are they 50-50? So you want to know a lot of their work that they're doing. And some of the main questions, I definitely think, it can be really tricky, right? It's a really fine balance between not asking the wrong question, because then you can kind of open yourself up to being vulnerable, to showing a weakness, being like, well, or it might come off as arrogance, if you ask certain questions. So there has to be a really fine balance. So you want to specifically say questions, for example, like, what are the mentorship processes here? Are they assigned to us immediately? I always, like, what I like to say to, and I really do think this is true to my heart, like medicine, I always like open and say, medicine has been an apprenticeship for over 2,000 years. And so what's really important to me is mentorship and growing. And so could you tell me a little bit about the structure here, as how like you're assigned mentors and how you work alongside them? And then kind of like questions, I think, less geared towards residency, more geared towards fellowship, is like what your research opportunities are going to be and how they're going to help you grow. But you want to kind of find like small questions that are not going to open you up to be vulnerable, and also questions that are really going to be useful. Like, you definitely don't want, there are two sets of kind of questions you're going to ask. You're going to ask your interview questions, but then you're going to ask the fellows questions, like about cost of living and like, like day-to-day life stuff. Never ask the interviewers those questions. Those are reserved for the fellows. Like, do not ever bring those up. Like the fine day-to-day life situation, you want to keep those towards the residents that you're going to be interviewing with, or the fellows that you're interviewing, etc., depending on what you're interviewing for. So know who to divide those questions to.
Okay. So I will take now some questions which are coming in on our YouTube channel. First, can we, or should we prepare for, I guess, medical questions? So Sukrut, what is your, did you get any medical questions in the interviews?
So I wasn't asked any medical question, but I believe a few programs in the East Coast, they tend to favor asking medical questions. And from what I hear, they were how do you manage DKA? How do you manage somebody who comes in with chest pain? Those standard questions. Just know your basics, which you probably already know. I don't think that they'll ask you how to treat some complex disease that you've never heard of.
Okay. So Kimberly, maybe I'll take the next question to you. Any tips on how to be professional and nice at the same time?
Are we just all professional and nice at all times? I don't know. I'm just kidding. Professionalism is such a hard topic to address in 45 minutes. I think the basic things you really want to hit is, first of all, just look at Sukrut. Looks very well put together. Shirt is very neat. Uses excellent hand motions. Look at his mic. That's completely sold. He's a really good example of what professionalism is, right now, specifically for an interview, as well as Puan. Very direct, dressed appropriately. You want to make sure that your body language is in check. Your facial expressions match what you're saying. Okay. And then, how to be nice. I don't know how to tell you how to be nice. I like to think that that's a natural part of my personality. And know your strength, right? Like, if your strength is being funny, try to be funny. If your strength is being charming, try to work on that. Like, that just comes with I mean, I'm not gonna say being nice comes with practice. Like we should just always be nice people. But you do have to show that you are a solid individual, and that you are open and comforting and warm to people, because that's what medicine is about. It's about knowing how to empathize and how to be warm to people who are very vulnerable when they're sick. So that's just something that's going to have to come from within there. I don't think that there's any specific advice on being nice.
Okay, I'll get the next question to you as well before I move to Sukrut. When you meet up with residents virtually and with the group of other interviewers, do you have to try to be very communicative? Is it bad to use the chat to ask questions at that time?
You definitely, I think you at the time when you're meeting residents, that's the time to get the most amount of information. I like to say it's the time you're gonna get the nitty gritties and the downloads of the program. You're not gonna get that from the interviewer, So you definitely want to voice up some of the questions and not make them seem harsh, just like what, basic things you want to definitely speak about is like call schedule and, what the cost of living is like, where most residents live. Is there housing that's associated with the program, or like housing grants, etc. So when you're meeting with the residents, I think that's also a really good time to practice being nice, I guess. So you want to use that opportunity to talk to them, right?
Yeah, so don't use excessive chats, but talk to them. I think the question was, should we only, or how much of chat can we do? So I think
I would say talk. Yeah.
Right.
Don't use a chat, right? That's a good time to also practice how to meet new people and how to be in a different situation and scenario.
Yep. Okay, Sukrut, next couple of questions I'll get to you. Can we schedule interviews, say, a month later after the invitation? So does the time of when you interview make a difference?
Not really, but if your profile is strong and you have a good CV and you're going to have multiple interviews. So one of the things that you could do is, some place that you're not too keen on interviewing, you can put that first, followed by the one that you really want to interview, that you can time it second. So the first one that you interview is sort of like a practice session, but it doesn't matter when and where you interview. The program where I matched, I interviewed in December actually. Yeah.
Okay. And the next also for you, what CV related questions should we be prepared for? I think it's a high level question, but everything, right? But
everything.
What's your perspective?
Everything, anything that I put on my CV is fair game. As my mentor was Catherine, and she always told me that anything that you put on the CV is fair game. If you don't prepare for it, it's your loss. You have to know. I had volunteering experiences. I had questions, 3 to 4 questions for that one volunteering experiences, because I was scared, because I didn't want to be in a situation where I was unable to answer something that was on my CV that I should know about.
Okay. And I know, you both of you are busy and about to, we scheduled 45 minutes. So I'll take rest of the questions as you leave, but one more question for you. Only Kimberly, you can answer it. Neither Sukrut nor I could answer it. Dress for women. Do we have to wear a suit, or can we wear a simple plain dress without a blazer?
I think it's going to be your personal choice. For me, I think it's always safest to go with a suit, because you don't know what length of dress might be viewed as appropriate, whether right above the knee or below the knee. That's just my personal choice per se. So I never wear a dress to these interviews. With that being said, if you're going to conferences or presentations, that might be a little bit structured differently. I think personally, it's safest to wear a suit. But if you feel that, the dress that you're choosing is very professional with a jacket, then that should be completely fine as well. Just know that the length of the dress should be very appropriate, because that is what is deemed professional in our world. So be very careful when choosing a dress or skirt to go, and make sure the ensemble is put together very well.
Okay. Well, thank you very much. I will not hold you back any longer. You guys are very busy. So I wanted to just thank you for some great tips, and I'll take the rest of the questions. So feel free to leave. Thank you very much, both Sukrut and Kimberly. Thanks for a very great session.
Bye. It was lovely to be here. Thank you so much for having us.
Thank you. Thank you, Sukrut.
Thank you. I can say, Pawan, I've got nothing to do.
Okay, well, I'm sure you have everything to do, but okay, if you can stay, that'll be good. So
I
yeah,
can stay 5 extra minutes if you really want.
Okay.
Sukrit backed me into a corner.
All right. So, Sukrut, question: how many interviews does a typical program conduct?
So it depends from program to program. I think this program that I am at has 24 had the previous season 24 interviews, and they interviewed about 5 to 6 people every day. So 30 times 6 is 180 applicants. But again, this is a DO heavy program, so it's very different from an ING specific program. So if I were to guess, I would say for maybe 10 spots, they would call about 200, 300 applicants.
Okay. All right. So Kimberly, you're still here. So how do you handle questions about research if you don't have any research and you're interviewing at a university program? How do you handle it?
Yeah, no, that's a really good question. It's always really tough, like if you don't have any previous research experience. So I think one of my most recent encounters, somebody asked me that question, and I said, "Well, if you don't have anything, you spoke about a very personal story. I won't mention who the person is, but just the story is, that they, for example, within their community, increase their vaccination rates." So was like, well, you did such a great job. A, congratulations as a healthcare hero. Focus on that. But B, what you could say is that, what I noticed was that this strategy that we put in place reached about 95% vaccination rates in a very predominantly vaccine hesitant population. And so I'm very interested in retrospectively reviewing what did we do differently, and can we come up with some pointers and strategies to implement that within our population, especially since, for example, like in India, like they were hit very hard with COVID. And what strategies can you put in place from this interesting thing, or this thing that you're really interested in looking at? So it's once again, don't fib. You want to definitely find something that it's true to you. And it's always tough. But one thing you don't want to do is go in there and say, "I'm not interested in research. Sorry, I have none. This is the limitations of my situation." They don't want to hear that, right? You should be proud to be an IMG and focus on your strengths and find a strategy to fill that. That's my best advice. And that's actually what I did too. Like I actually kind of hopped on to something when I was doing the residency interview. I was starting something, but did I think it was going to be fruition into something real? Probably not around that time, just because I know the limitations as well as an IMG. Obviously, very different case scenario here when you're in the US. But you want to not focus on, what you don't have. Try to pivot that and make it into something that you can have. That's going to be my best advice.
Okay. Yeah. Last kind of question. How many interviews do we need to be confident in maths? Sukrut, do you want to take this?
10. 10 is the magic number.
10 is the magic number as per you. Okay. All right. And you're talking primarily internal medicine.
Internal medicine, yeah.
Okay. So we already took this question. How do you answer the question? Tell me about yourself without boring the interviewer. I think Kimberly handled it very well. So for those of you who missed it, go back to the beginning of this session, and that is one of the best answers I've heard. So that's a good one. Will the interviews be virtual this year? Pretty much. We can safely assume no program or no specialty has said that they are going to be on site. So I think it all will be virtual. If things change, we'll find out. But I think they're all gearing up for at least one more season of virtual interviews. And I think that is pretty much it. Thank you, everyone. And thank you again, Kimberly and Sukrut, for a very nice, great session with a lot of tips. Hopefully, students got a lot out of this and they can use it in their season. So thank you both.
Thank you, Pawan. Thank you.
Thank you. Bye.
Bye.
Bye. Okay. Let me see if there are any last minute questions. I did see one question. How do you address applying to multiple specialties? So if you are applying to multiple specialties, you have to focus on obviously specialty specific LORs, even if you are applying to multiple specialties. So IM, FM, some of it is common as in the primary care, but LORs would be one way to differentiate for that specialty. Then would be your relevant work experience in that specialty. Unfortunately, there is no best way to do it. You cannot dilute CV in one specialty and make it stronger in the other. And I think Dr. Watts from Cook County did answer this question last week as well. So it's a hard one to do. Okay. All right, I think that is pretty much it, all the questions that I saw. And good luck to all of you who are in the match this season. If you have any questions, look us up. And we do have an open Telegram group for those of you who are interested. Of course, there are our services and our team, but I'll give you the link to the open group if on Telegram, that you can all join, and of course subscribe to this channel as well, and hoping to help you in the season. Thank you all. Good luck.